COVID-19 has put Venezuela's healthcare system to the test, and recently discovered variants may present an even greater challenge. Even before the onset of COVID-19, hospitals struggled to keep the lights on, the water running, and basic cleaning supplies on the shelves.
Here in Venezuela, our hospitals have just 2, 3, or 4% of basic medical supplies, and people were dying even before the pandemic arrived.
So far, Venezuela has not reported any cases of the COVID-19 variant that's devastated the Brazilian city of Manaus on the other side of the border. But health experts say it's likely just a question of time.
Mobility and human displacement are the engines of the behavior of a pandemic. So it is perfectly possible that these mutations come and we don't even notice them because there is a weakness in epidemiological surveillance.
Venezuela's borders have been closed to international travel since March, with just a few exceptions. But according to the UN High Commission on Refugees, tens of thousands of Venezuelan refugees and migrants have been returning home over the past several months. Many of them are traveling overland through Venezuela's porous border crossings. Health officials and residents alike are worried the cross-border travel will bring the virus and its variants into the country.
It's something that is in the air and is transmitted from person to person. So at any point, if people pass through the borders, it will get here, like COVID-19 arrived.
Meanwhile, healthcare workers worry about the risks as they wait for what may be the inevitable spread of the coronavirus variants.
Out of all the deaths officially reported by the government, 24% correspond to physicians. If we add in other healthcare workers, that accounts for 30% of the total death toll.
According to the NGO Doctors for Venezuela, more than 300 doctors and nurses have died from COVID-19. Venezuela's vaccination plan is counting on the Russian vaccine Sputnik V, but so far no schedule for that has been released. Maritanimena, CGTN, Caracas.